brilliant. And Manos and Jakob, I think, are going to come in on this point.
I would like to add to Jasper's about long-term monitoring, which I totally agree is critical for such a population, such population groups. But we're not limited to consumer wearables, because there are research wearables. We are testing actually now a device from a manufacturer called Sense in Denmark, as it happens, from Denmark, which can measure 22 continuous weeks. Not only that, it communicates via Bluetooth. The accelerometry signal is communicated to the smartphone, and from the smartphone automatically to the cloud for up to 22 continuous weeks. So we will see in the next few years, I think we're going to see big things when it comes to the measurement and overcoming limitations. Like this is a brilliant example that Sonia gave us the opportunity to comment on. Thank you.
Thanks. Jakob.
Yeah, that's going back to people with chronic conditions. I think this is an area where it will be really interesting to see if the devices provide the same level of kind of homogeneity in the guidelines that we have based on self-report. Because right now the guidelines are the same for people with and without chronic conditions. But there's a lot about perception of physical activity, and if you have a chronic condition, you may perceive physical activity differently if you don't have chronic conditions. So I'm very curious, and I think there'll be a lot of development in maybe tailored guidelines for people with chronic conditions, also with their specific comorbidity outcomes. So I think this is an area where we need to expand with devices, and we'll see a lot of interesting data in the future. That's my expectation.
Okay, brilliant. Thank you, Jakob. I'm going to move across because we've had a couple of questions on sleep. So one of the comments I think that was useful here was to talk about the massive sleep research community that probably also have activity in their data that they might not be overly interested in. So thank you for that comment. But the two questions that came up were, how should we deal with naps in sleep data? And also the fact that many of us, myself included, this morning as I got up very early, my phone tells me I didn't sleep enough, or I didn't sleep deep enough, or whatever. How might we use some of that data that's available, and also the issue of naps? Annemarie, can I start with you on that one?
Yeah, so I've in preparation for my presentation, I looked at indeed also naps, how well accelerometers capture it. Well, the answer is not good. So I think that's a problem, that we really do not capture naps very well with accelerometers. So I think we need either a combination with diary data, or it's difficult to capture otherwise. Yeah.
Okay, and a nice comment in there from Gemma here in Scotland to say that, you know, we've now finally come to an agreement in Europe about standard phone charging cables, so that when we change phones, we have a standard cable. And is there a way that we could advocate perhaps with the phone companies and tech companies so that we had a standard measurement of physical activity in phones? Now there's a task for somebody to take on the big phone producers. Good luck. But a really good suggestion. Anyone else from the panel want to come in on sleep? On the issue of sleep? Yeah, Karen.
Yes, I was just going to add that I think that there's a whole community of sleep researchers out there, and one reason why we didn't consider sleep in the WHO guidelines was that we didn't have sleep experts on the panel, and there's separate sleep guidelines. So I think that when we look to review the guidelines in future, we should make sure that we are engaging with the experts in sleep. It's obviously great that we're becoming experts in sleep, but we shouldn't forget that there's people that have been doing this stuff for a long time, and they're probably much more advanced than we are in how we measure this stuff and what it means for health. So I think that there's a whole community there that we could be working more closely with.
Peter.
I just wanted to ask about, there's a question in the chat earlier about incorporating sleep into the guidelines, and whether this people view this as kind of a nanny state, where we're now telling people what to do 24 hours a day. You know, we've got the physical activity, sedentary behavior, and sleep. And I know Canada has integrated all of that. into 24-hour movement guidelines. I'm Canadian, and Canadians like to follow the rules, so it might not be too bad. But in the US, we didn't go that way. We purposely did not include sleep in the physical activity guidelines, and that was part of it. A lot of people don't like to be told what to do, especially 24 hours a day. So I don't know if others on the panel would have comments on that, because it, you know, with device-based measures, we can start kind of prescribing 24 hours a day to people, but will they push back on that?
Yeah, thank you for bringing Sonia's question up. That was Sonia Kalmayer's question, and it's a really useful one, because I think culturally in different countries, I mean, you say Canadians are rule followers, there's lots of countries where they really, I think, will push back. So I agree with you there. But Joe's going to come in there.
Yes, I actually ran some public engagement workshops discussing the 24-hour guidelines, the WHO guidelines, and it's quite interesting because it was small. It was just 10 members of the public, but there was a lot of pushback about 24 hours feeling very restrictive. You know, well, when can I do what I want to do? There's only 24 hours in a day. And we discussed each of the behaviors, and sleep was the one that everyone had a problem with, because they just didn't feel like the Canadian guidelines were realistic and that they were obtainable. They said, well, that would be great to sleep for 8, 9, 10 hours, but I can't. I have caring duties, I have work, I have this, and you know, they want me to have regular sleep and good quality sleep, but it's not necessarily something I can go to bed and say, I'm going to get 9 hours of good quality sleep. So it's interesting that you raised that, Peter, because that was the biggest pushback from the public.
No, and that's my frustration. I'm a bit of a rule follower, and there's nothing more frustrating than waking up and realizing you haven't had enough of the sleep they really want you to have, because what on earth can you possibly do about it? It's very frustrating. Okay, Jasper.
Yeah, I think that's a very interesting discussion, and to me it illustrates very much the point that several speakers have made before, that there might be a difference in what we communicate versus what we have in our guidelines based on the evidence. And I think this is one of those examples where, perhaps from the lessons learned from the Canadian example, well, do we really want to have the 24-hour with the 3 things integrated? Is that really a message we want to send? I don't think that changes anything about the evidence that we have that, well, doing that would be healthy for you. That doesn't change. But the question is more there, I think, about messaging and communication than it is about the evidence, which again makes me think, okay, well, perhaps some of that we really need to think of it from the other side and think of, okay, well, what makes sense in terms of what do we tell people, both the public and the health professionals that are sort of often the intermediate there.
Brilliant. Okay, I'm going to move on to another question. We have a nice question in there from Saud, which is like some suggestions and a question, because we have talked a couple of times today about no matter where we get the evidence from and no matter how we make up the guidelines, ultimately what we're trying to do with those guidelines is to change behavior and to you know, get the public to be active. And so I suppose the question here is about, does anyone think that a tool that could be used by the individual to motivate them to move, whether that would work, and should consideration of that tool, if I'm reading the question right, be involved when we're talking about drawing up the guidelines? Jasper.
I think Karen might have been first. Do you want to go first, Karen?
I'm sorry, Karen.
Go for it, Jasper.
Yeah. Okay, you can have your chance after that. So I think this is a very interesting idea. And I know that there are a number of projects out there that are trying to do this, that are saying, okay, well, because we now can measure behavior so detailed per person, and then we also know that what the barriers and motivating factors per person are also different. So potentially we can use the fact that a lot of people have a phone, they have a wearable, and they can tell us about their barriers and preferences. Well, can we then develop device-based, tailored, individual messaging to them saying, well, okay, with your pattern of behaviors, you have the opportunity to do in this bit of time during your day, you have the opportunity to do more of this. So there are studies going on at the moment that are trialing that. Is it the future? I don't know. Is it something that I personally think is really interesting to experiment with? Yes.
Yeah, and I think the personalized medicine has really opened our eyes to thinking a little bit more about how do we make the guidelines more specific, and if we make them more specific and individual, will that get greater adherence, because people think this is tailor-made for me. Yeah. Okay, Karen.
Thanks, Marie. So I was just going to add that I think we need to do way more on the kind of behavior change side of things. And I think for a long time, we've constructed guidelines and then said, hey, general public, here's the guidelines. But we know that people may perceive the guidelines to be unachievable, so that could be demotivating for people. Also, the evidence that's used to inform the guidelines, for example, reduced risk of cardiovascular disease in 20 or 30 or 50 years' time, is not what motivates people. It's what motivates people is better sleep, better mood, feeling less stressed, feelings of well-being. So the outcomes that we're all motivated by are not the outcomes that are communicated, that are considered in the construction of the guidelines. So I think that we need to consider these two things quite separately. So the scientific guidelines is a academic exercise to use the best available evidence to construct, consensus on what we know about the dose response relationship. But how we motivate people to change their behavior is a different question. And we need to stop kind of merging the two issues. One is a scientific exercise, the other is a behavior change exercise.
Okay, thank you, Karen. Jakob?
No, I was just thinking that we talked about pushback with sleep-specific guidelines, and now we're talking about an app telling you now you have the opportunity to do this right now. I'm quite skeptical about these individual agency approaches. I think there's a lot of evidence suggesting that in general they have failed in moving population level physical activity. So I think that we kind of have to focus on policymakers in constructing build environments that makes it easy for people to do just a little, just sporadic physical activity, taking the car to walking for grocery shopping instead of taking the car. And I think that is the most important message that we can deliver as physical activity researchers, that anything you do will probably do you some good, and at least it will do you no harm.
Yeah, that's useful to pare it back to the basics of what we're trying to do here. So very good. Thank you, Jakob. Manus.
Yeah, thanks. Jakob. You raised a really, really important issue, and I totally agree with you that in order for public health and physical activity guidelines is part of public health, to achieve large-scale change out there, we are talking about upstream solutions, environment, and things like that. At the same time, I think sometimes I feel that public health rushes to dismiss the individual level approaches, because I think these have a time and a place as well, especially when it comes to healthcare systems, primary care, clinical interventions. All these are areas, all these are opportunities also to motivate, inspire, empower, support people to be more physically active. I agree that ideally we should make each and every city around the world Copenhagen. I mean, that would be my dream to have. I'd like to have a couple of Copenhagens nearby because it's really far from me here in Sydney. But I think this is not, this is very hard to achieve. So this environment, changes in the environment that will make the physically active option the easy option. This can take years and decades and are very hard to implement because there are financial interests, there are all sorts of things, car addiction, to name a few. So I think I agree that changing the environment is the way to go. advocacy, policy is a way to go, but we should not dismiss individual level approaches, including consumer wearables and what we've been discussing about the trackers, incorporating the most up-to-date knowledge based on physical activity guidelines, which I feel is a very important translation of the physical activity guidelines work we are doing. Because those have merit and those can achieve change in some sections of the population. Thank you.
Yeah, excellent. That we need to hit every level, not just individual policy, but we mustn't throw one out for the other. I think a multi-pronged approach will work best here. Jasper.
Yes, I wanted to say thank you to Jakob to bringing up a very important point that a lot of the research I'm involved in is trying to do that. But I also wanted to say that in Copenhagen, where I happen to do a lot of my research, where in many ways the environment is very conducive to being active, we still have a lot of people that are not active. And so quite interesting, some of those individualized approaches are actually aimed at, well, you live in an environment where you have all the opportunities, but you're still not being active. Perhaps part of the reason or part of the explanation is because you don't know you have the opportunities, because you're in your habits, you don't think about it. So sometimes I also, just like Manas just mentioned, believe that we shouldn't dismiss the fact that a little prompting might actually help people realize they can very easily change something in their behavior because they have the opportunities. So I think a good combination, is a way forward.
Okay, brilliant. I think that's an appropriate answer to finish on, that everyone has a role to play, and that interventions at all different levels are likely to have the best benefit. So I think at this point I'm handing back to you anyway, Manos, although your hand is going up, but I think according to the great instructions you've given me, I'm now handing back over to you for some closing remarks.
Yeah, thank you, Marie. That was an amazing session. Just to build on Jasper's point, a personal story about the value of nudging. I hadn't run for about 2 months. I met a friend who kind of told me, you haven't run for 2 months. This week I ran 3 times. So a little bit of nudging can make wonders. Thank you very much, Marie, again. And I would like to hand it over now to Karen, our co-organizers of this event. I hope you enjoyed it. It's been a great pleasure to have so many of you. We had between 100 and 180 people at any given time. This is fantastic. So a big thank you from me as well to ISPAC for putting the logistics, for doing all the work. And back to you, Karen, for the final remarks.
Thanks, Manos. So yeah, I would like to say that I think this morning for me, evening for others, has been a fantastic event, and it's really great that ProPASS is leading all this work, and it's really great that ISPA's been able to be part of it. This satellite event was initially planned to be in Abu Dhabi last week, and we decided to make it an online event in order to broaden the availability of people to join. And the fact that we've had 170 odd people at various times in the morning, I think is testament to the fact that we made the right decision there. I'd like to just thank all of the speakers and also our chairs, and particularly Marie, for facilitating that quite lively discussion. I'd also like to thank Tepi and Jimmy, who behind the scenes have done all the logistics on the ISPA side of things. And yeah, congratulations to all of the ProPASS team. Many thanks for your presentations, and we look forward to advancing this agenda, not only to produce device-based guidelines, but to consider how we message that, how we conduct surveillance, and how we change behavior at the environmental and the individual levels. So yeah, many thanks everybody for joining, and yeah, keep an eye out for the next steps from ProPASS.
Thank you all.
Thanks, bye.